seeing that smile after, especially pediatric emergencies, when you fix the problem, they are smiling, they are running around. That kind of feeling is not something you can buy with the money.
Welcome to Brave. Learn from Southeast Asia's best tech leaders. Build the future, learn from our past, and stay human in between. No BS on success. I'm Jeremy Au, venture capitalist, serial founder, Harvard MBA, science fiction nerd, and dad of 2 daughters. Every week, we debate startup news, interview changemakers, answer listener questions, and share personal insights. Join our movement of over 40,000 members and get transcripts, resources, and community at www.bravesea.com. Stay well and stay brave. Hey, Yudara, really excited to have you on the show.
Good morning, Jeremy.
I've known you for a couple of years now, ever since building out the startup. It's been fascinating to see you transform both as a person, as a founder, but also bringing the practice of medicine and startups together. Please introduce yourself.
Thanks, Jeremy. It's a pleasure. I'm an engineer, doctor, and by chronological order. I'm self-taught from reading books to an engineer, used to code quite a lot of time, and then started my medical education, graduated from NUS as a doctor. Of course, after 15 years of being a doctor, I moved to an entrepreneur. Happy to walk along the timeline a bit in detail in the next segment.
What was it like growing up in Sri Lanka and moving to Singapore?
Yeah, Jeremy. I was born in Sri Lanka and grew up in southern part of the country and then moved to Colombo, which is the capital. I did my primary and secondary education in Colombo. I was lucky enough, they have something like PSLE, so I get to move from a village to the capital to study in the number one school of the country. I was very passionate about pushing myself, so it was a good chance. Through that, I managed to get in through my O-levels and get into the best medical school, but focus a little bit of growing in Sri Lanka. I think now that I'm living in Singapore, I see the big contrast. When we were small, my primary school was literally on a beach. So bigger part of my primary school is playing cricket in beach. And when the teachers come only, we run to the class and start studying. It was a very fond memory and I have a lot of happy feelings about it. So I think that was a massive deal. We used to understand the society, the connections among people and the value of life and money because Sri Lanka is a developing country. Southern parts are even much more poorer, even though I'm born to a relatively well-positioned family. I grew up with the kids and then I used to see these things and grow up with that. And of course, then moving to capital, it's a big city, relatively close to Singapore. From medical school, I get to work with 2 professors in Singapore in NUS, and they asked me to move over. There was a path in my medical school to NUS medical school. I can switch over at any time. Sadly, it's not there anymore. With that, my switch over to Singapore to complete my medical school was another big cultural difference. And yeah, it was all good memory. I honestly wish, knowing that my sons are growing up in Singapore, I want to send them to either in Sri Lanka or Taiwan, which is my wife is from, to grow in a real village.
Like you said, there was like 3 differences, right? It was a village to a city. It's from Sri Lanka to Singapore. And obviously, you're changing your medical school as well. So what was the culture shock of arriving in Singapore?
It was a massive cultural shock. In Sri Lanka, in my college, I used to speak British English. And then, of course, we have Singlish here. That was a big, even though you think it's small, but I had a lot of confusions, misunderstanding. And Sri Lanka, India culture is that when a senior says something, we don't question at all. We keep the head down and yes, and that was very different from Singapore. There were a few times I thought I understood the instructions, but I never questioned or clarified. What I thought I understood was wrong. So I execute the instructions and then it was wrong. But that was for 3 months. I adjusted quite fast, thanks to a lot of friends, even before I come to Singapore, because there were quite a few friends I knew from Singapore who were in Sri Lanka and then through my family. So it was a bit of a bumpy road.
And what's interesting is that you chose to not only study medicine, but also continue in it. What drew you to medicine in the first place and why did you continue? Because a lot of people started and they don't complete, for example, right? So why start and why continue?
Even though I started my growth in engineering first, when I was about 10, I started coding in languages which a lot of people now don't know. like Q-basing DOS and carry these programs in 3.5 diskette. But when I start to grow, I always had this passion to help people. And of course, being born to South Asian parents, they always say being a doctor is the biggest thing. And on top of it, my family didn't have any doctors. We had engineers, lawyers, but not doctors. So they were always saying, why don't you just be... They didn't push me per se, but because I was doing very well in academics, they said, why don't you do medicine? And I thought about it. I also felt that's something I can help people really a lot. I loved it. I enjoyed my medical school time. After that, actually, I want to consider doing a surgical topic as a specialist. But when I started doing it, I realized it's not for me. And then I was accidentally on the first day itself was pushed to emergency department in KKH in a pediatric emergency, and I loved it. That was the turning point, and I never looked back. And of course, I trained as an emergency physician and a specialist in NUS and UK and US exams both. And yeah, the biggest thing is when people come in their lowest point of their life, usually emergency for most of them is the lowest point of their life. It can help them to come over and seeing that smile after, especially pediatric emergencies, when you fix the problem, they are smiling, they are running around. That kind of feeling is not something you can buy with the money. So when you feel that, I never felt that the pain. I was always looking forward to it.
So what's it like to lead a pediatric emergency team? Because you mentioned that you've handled and managed over 10,000 emergencies. First of all, these are kids, right? Pediatric kids, so obviously they're cute, but you're talking about emergencies. So what kind of emergencies are you talking about?
I'll start with some joke because, as I said, I was pushed to pediatric emergency by accident. Nobody in doctors community goes to pediatric emergency because it's very tough and parents are very tough. You don't get praises at all. I was there by accident, and I tell my super that time, look, this is like a transition. Just give me 3 months. You won't see me anymore. He said, yeah, sure. We need people because there's no one to work. And after that, I stayed there for 4 years, pediatric emergency, and he still laughed at me and said, look, you only asked me to stay for 3 months and then you've never left the department. I truly enjoyed, of course, after becoming a specialist, there was this interesting situation. Government was in a hospital. It's being a new state. There's a lot of young families. So the Ministry of Health wants to have a pediatric emergency in Sengkang, and they were looking for suitable people. My original plan was to complete my training and go back to KK. But at that time, the KK head is asking me, he's trying to start a small department there. We will support. Do you want to take it? And my other bosses felt I'm suitable to run this small team from the beginning. So I pick people, I write the necessary pathways with KK Hospital. And I started small. This is pre-COVID. And we did a really good job. We built a team to a point that we actually seeing roughly about 10%. And I had a very small team. It was under the bigger emergency department, and we run as a small team. And we had a separate nurses, separate doctors, and then a separate small space. We call our own pediatric corner. And it was a beautiful experience. But of course, with the COVID, things change and hospitals completely change their physical structure and so on and so forth. And same time, that's where my transition to entrepreneurship comes in.
What does a pediatric emergency look like? What does it mean? You mean like baby's crying or they're going to die? Could you share what a case of a pediatric emergency could look like?
Yeah, Jeremy, you tell the two ends of the story. Sometimes babies crying with first-time mothers, they don't know what to do, they bring to emergency. And sometimes it's just maybe they're hungry. Mothers are not feeding enough, or maybe they're feeding too much and then baby is too full and then feel bloated and they cry. That's like the simplest thing you can see. Of course, we help them on that. And sadly, sometimes we see life-threatening conditions leading to death, or even serious accidents which can lead to death, bring to pediatric emergencies. So we have to be prepared for whole spectrum of things. Again, it's not one-man show, it's a whole team. As a department, we train the doctors a position in Sengkang for us to get used to it before they transition out. Usually it can be simple infections, fall downs, small fractures, sprains, bumps, and serious things like kidney problems, heart problems. Even though they are rare, it can happen to babies because their organs are growing very fast. So we do see the more serious ones. And of course, rarely we had cases, we had pediatric serious injuries. Even now, every month you do see one or two, sadly.
And you mentioned that you started exploring entrepreneurship. So there you are, you're enjoying electric emergency, and for the first time in your career exploring entrepreneurship, which is a very different role, different function. So how did that interest come about?
Actually, it's not like a switch. Of course, there was a time where I switch over, but it's a continuous process. As I said, I start my life coding mostly. When I go to medical school, I never stopped coding, and I was always in tech. And then my best friends are always proper engineers. I'm the tech bro who's in the medical school. But with those things, we write small things, apps, and then we play around. There were two main events. Even my medical career on the background, I was hanging out with my engineering friends. Two events happened for me to truly force out to do something by myself. One is, of course, one of my friends one day sent a message to me saying that thanks for being a good friend. And knowing an emergency doctor, I have seen this kind of things in suicide notes. I was immediately worried that whether this guy is going through something in a crisis situation. So I quickly rushed to his house. This guy was in the balcony about to jump. Then we grabbed him and I asked him what's going on. This is 2019, Christmas time. He was saying, I'm dying. I was like, look, as a doctor, I actually used to manage his medical records. So I know his records. I was like, no, you had the test, you were fine. Of course, he can get new infection, but I was like, how do you know that you had the infection? He said, I embarrass everybody. I don't even want to tell my wife. The social circumstances were so strong that he had unprotected sex with someone outside his marriage. And then because of it, he didn't want to tell anybody. He saw a rash on his private parts and he thought it's HIV by Googling his symptoms. It shows how much stigma and lack of access to data in sensitive areas causes things. And he was not ready to share with anybody, suffering internally. And at some point he thought, look, he thought he's going to die from HIV. He was like, look, why don't I make it faster so that everybody is happy? So that shocked me. I was keep thinking about it. I was in charge of the east part of the COVID operations with few of my colleagues. There were dormitories, S22 and so on and so forth. There were two young boys brought to hospital dead from COVID. And sadly, it broke my heart because we didn't even know they had COVID, the lack of oxygen, and died. And that kind of asked me, how come we have so powerful technology in the hospital, but at home you don't get access? Same time it rings the same my friend's incident. You have best technologies and care at hospital, but not all the circumstances warrants that people would want to come to hospital. Or sometimes they don't know they need to come. So then I thought about my friend while I was working in the COVID time because it's lockdown, so I had a lot of time. So I used some web images to develop a technology to see what a normal anatomy of a male organ looks like and what's abnormal. Then I pass it to my friend. He passed it to his friends. After about 2 weeks, a lot of random strangers messaging me, I love your app. It's such an amazing thing. There were no way I can understand. I had this pimple in my private parts, couldn't understand it. Now that I can understand, thank you. So I was like, wow, I didn't realize that's such a big gap. Thousands of download within 2 weeks. And then I thought, why can't I put some effort and try to improve it? As a second step, I can list down 3 diseases properly. I talked to a few of my friends. They all love it. Traction got more. I have to mention one guy, one of my doctor friends, Daniel, he said, dude, I think this is a good idea. I'll throw some money, just do it. But you have to quit your job. That was like, are you sure? I have a very comfortable life and my family is happy. He said, yeah, it's going to be tough, but just do it. And of course, I talked to my wife. She was an entrepreneur before. That was one of the biggest things. She said, yeah, let's do it together. And then in 2022, I jumped out and then started. Things grow well. We got funding from US. We moved to US operations. And I'll take a pause again. Of course, that's the real journey, ups and downs. So there were a lot of, here we are still growing in the right direction.
Can you talk about what health is first? And then after that, we'll talk about the ups and downs.
Yeah, it is a men's sexual health wellness app helping men detect STIs. The idea is clear. Build decentralized infectious disease detection models and diagnostic models in digital realm. So that means few things. It should be outside the hospital, easily accessible to people through their phone. It has to be digital. That means there's no physical things per se. It has to be data, images, sounds, whatever digital data we captures. And it has to be at population level. That means any disease at population level. Can we screen things in matter of minutes in people, millions? So that was the idea. And of course, we developed some technologies through HeHealth, and we slowly moved to things like monkeypox, which we are one of the leading research labs in the world. And then, of course, a few areas like synthetic data for COVID, we showed some innovative ways and hopefully not new pandemics, but If there's any situation, we are ready to roll some very innovative technologies. That's what HeHealth and the bigger vision is.
What were some of the ups and downs?
I'm very happy to share about the ups and downs. As a startup, we had a very good traction. We didn't have to do marketing per se. People are using it. There were times that we had 20,000 downloads in 1 week, and it was all around the world. We were sometimes surprised. Places like Uzbekistan, Kazakhstan, which I hardly knew where they are. During the early stage of the Russia and Ukraine war, we had Russians and Ukrainians using it quite a lot. We had really good run, and of course, because of the traction, we had significant exposure to the global audience through media, innovative ways, and so on and so forth. Of course, like any technology, you have hype, and then the fear factor comes in. And then when I started operations in US 2023, 2024, of course, a lot of people appreciate it, but few people felt few negative aspects of it, especially the data privacy part. As HIPAA in US, we had few extra layers of protection. And of course, the idea of we being collecting private pictures of men around the US for helping them still disturb quite a lot of part of the society. And then some misunderstood it as promotion of sex, which is clearly not. Sex and sexual health is very different, and we were focusing on people who have no information and access to care in a very stigmatized section of healthcare. Started with these three areas, especially data privacy. A few people felt there was no comparison before me to gauge and say, look, they have done this and then this is what they are doing. So it's standard or not standard. A few people start writing some negative, misunderstood concepts. The fear trend in social media much faster than the initial hype. There was a massive hoo-ha in US about data privacy, data storage, and consent, and so on and so forth. I believe innovation is 2 steps ahead of regulation. So we, as a doctor, took necessary steps. For me, there was one simple principle. As a physician, do no harm. Protect the patient's autonomy. You always tell the patient what it is and let them decide what they're good for them. We follow those things, but again, as I said, because of misunderstood writing about different aspects, we take it as constructive criticism, but that draws unnecessary attention from politics. And then I was literally caught up in massive ideological discussion in US about wokeism and sexuality and gender and politics. That clearly affects some people took their life's mission to destroy HeHealth, and they complained to governments, institutes, and so on and so forth. That escalated into some government investigations. We had multiple legal cases in 2024. We ran out of money because of the operations, legal cost, and we had a clear plan. Luckily, I was surrounded by good professors from Harvard University. Long story short, we are growing significantly in 2025. I have some big news. I'm happy to share one of them during the podcast for the first time.
Yeah, so let's talk about that because it's always tough to be part of legal, scrutiny. And in this case, we had the FTC doing the investigation, having a lot of conversation with you. It must have been very stressful. So how did you manage your own emotions or thinking? How was the experience like?
I think, Jeremy, the most important thing, negotiated, then get out of it without being fined or wrongdoing. That's very important. A lot of people put money to throw misinformation campaigns and digital campaigns against us. I got death threats in California when I was living in San Francisco. Anyway, coming back to FTC sent me a charge sheet, and then I look at it. They were suggesting I might face up to 50 million fine and a possible jail term. So I talked to my lawyers and they said that looks possible. I'll get you out of the 50 million fine to maybe 1 or 2 million. I'll guarantee that you won't go to jail, but you have to pay us to start 2 million and most likely in with 5 million. So they said the deal is clear, 50 million versus 5 million. That sounds obvious for anybody, including not going to jail. But I had different plans because I knew morally I didn't do anything wrong. I was very clear based on right principles of not doing any harm and let the people decide for themselves. And of course, we didn't have money at that time. Clearly, I didn't have 2 million in my pocket to pay to the legal team. I said, I'm going to take it by myself to tell the truth. And of course, I use AI in a very innovative way. We build a complete agentic system using FTC data, which is publicly available. And I trained a few agents, and then we literally had code discussions through agents. Of course, I disclosed them to them also, and in an email, they said I cannot video record the sessions, which is clearly code sessions. And I said, sure, I can take notes. They say, yes, sure. So my agents took notes and we work. And clearly what I did is I focused on telling the truth. I was very honest from end to end. And I think nobody have concluded the investigation in 2 months. We concluded in 2 months. They were very happy. We give everything. And of course, they did point out some of the minor limitations we had with our university collaborations and so on and so forth. I'm a very small startup. We raised roughly about 2 million. We are a pre-seed startup. Our revenue is definitely less than 1 million at that time. So FTC hardly go behind this kind of small companies, but they decided, and we showed that we have done our part. And they point out small things we could have improved. I accepted it as a small thing. Look, they were on the roadmap, but clearly we couldn't do it with our budget. And we agree on a settlement without doing any wrongdoing from my side. Coming back to mental health part, me and my co-founder was very stressed. Same time, I had really brave souls who backed me up, especially few professors in universities in US. When the university forced them to detach from my project, they said, no, we believe this is the future of sexual health. And this is how you get the technology to 300 million people overnight, literally, if you need it. And everybody carry a phone, and he developed a technology and patented, and he's the only guy who can do it. So they were backing me. And with that strength, I managed to keep my head down, focus on telling the truth and completing our journey. And of course, now looking back, all the legal battles are over, and everybody agrees that there were some minor points, but we are in the right path with the right intention, most importantly. And here we are now working with governments around the world to bring the technology to the people's hand.
Yeah. So I think it's interesting because the issues that you ran across in this case applies to broader AI tools in medicine, which is about like the guidance, diagnosis, training data. So let's talk about those issues, right? So I think for me, when I looked at the FTC letter, I think there were two components, right? One was like the training data, the approach, the level of quality. I think, and I think that's on one side. And then the other side, of course, is your marketing, that you're making a diagnosis, whether you're supporting a diagnosis with a doctor versus making a diagnosis. I think there's a lot of variations of that, right? And I think that's almost every AI app is trying to automate diagnosis at home, and they have these two issues. So could you talk a little bit more? Because I know you're building a GP AI as well. So how do you see those two aspects? Right? One is the data side, the other side is the diagnosis. How do you see those things playing out?
Sounds good, Jeremy. Data is something I'm very passionate about. When we started the project in a peer-reviewed paper published in Mayo Clinic Digital Journal, which is considered one of the top 5 global digital publications, I explain every step from step 0 to step 5, every single data point, how I collected, how I get the consent, and so on. I want to stress few things. Of course, we decided that how we're going to do is incremental increase, rather than you collect data for 5 years and do it after 5 years and validate, because technology moves too fast. Technology moves so fast that even now, when we publish a paper, our technology is twice as good as what you publish. And this is a limitation of FDA also. There's no point getting FDA to a technology where 6 months later you have twice the better technology. You have to reapply and modify your submissions. So we thought, okay, we are going to be very honest, upfront, communicate these things, and we are going to work with all the organizations. So I work with FDA, for example. I have spoken them as a content expert about the data in FDA conferences. One of the biggest thing is we collected initial data from the community, send a brochure saying that people did respond.
Pick for science.
Yes, believe me, people responded. One guy had monkeypox. He documented from day 0 to day 14, multiple pictures every day. He sent 150 images in one shot. He said, use it. Help other guys who might have the infection. That was one of the best documented data sets I have ever in my life. We took a different approach. Instead of you going to hospital, get the hospital approval and collect the data from there, I said, I'm going to go to the patients itself. I'm going to tell my objectives, and I'm going to collect it from there with their consent. We documented. We had IRBs, that means ethical approvals for these things. We are a small startup. They were comparing things with relatively known areas like neurology, cardiology. If you look at comparatively, Harvard have a sexual health group which is working on these kind of projects. They released a monkeypox model at that time. They had 1,000 annotated data. So it's published in the paper. I publish on the same time, and my data set is 10,000, 10x better. They collected from the hospital, I collected from the people, of course, with very ethical ways. But if you look at it in the bigger view and say 10,000 is small, I agree. The second part of it is, I have to tell this story because when you run the first model, collect data is mostly from US, which is white skin. And I run the model, and then I realize brown skin users have a lower accuracy. I was like, wait, I have a brown skin. What you're saying is I build a model which is biased towards myself. I said, no, I cannot accept. So we publicly talk about it. I put a lot of resources as a small team to build the answer for this rather than complain it for the rest of the life. So we build a synthetic data pipeline, which we actually created. For the first time, we use it and then we show that it works. But we being industry leader at that time, first person to publish a Nature publication on synthetic data and it works well, reduces bias in data. Sadly, the paper comes after the FTC investigation. So I said I have preprint. We already put it in archive, which is accepted nowadays. We publish it in preprint. They felt, they didn't say it's wrong, but they felt that there were some missing points they want to verify. I said, look, time will verify these things. You just have to wait. But they agreed that there's nothing they can find wrong, and then they closed the case. So that's the data part. So I think now the data is moving so fast. If you look at OpenAI O3 model, internally, we from San Francisco, what we hear is it's mostly trained on synthetic data. That's the future because these are clean, solid, small data sets rather than you look at a lot of rubbish, which there is no value. When it comes to penis pictures, in the internet, there are massive oversupply which have no value. So that's the problem. So we created proper annotated medically needed data sets for the first time in the history on this sensitive area. So that's the data. I'm not going to go into details.
Maybe before we go to the diagnostic side, the traditional approach has been that you need a very large set of human data, raw data, annotated, diagnosed, etc. But of course, the problem is that with sexual health, it's hard to get that list because it's a stigmatized disease. So you're using a combination of crowdsourcing that data, citizen science, AI to push the patterns and synthetic data on top of that. It's a very different approach. Do you feel like that's going to change? Because for me, when I hear synthetic data, I'll be like, isn't synthetic data just create its own junk? If an AI trains itself, does it go crazy?
So that nicely connects to the next part. I think you need to have a human in the loop. I was talking to another doctor who's against synthetic data. AI, using AI data multiple times, the model will collapse. This is where the human is not in the loop. AI is not what we call AGI, artificial general intelligence, that it can go by itself. No, you have to have guidance. But when you use the guidance to create the synthetic data in the right way, it clearly increased the diversity of the data set. It clearly increased the quality of the data set. You don't need trillions of GB of data sets to create. You have a very solid, very well represented data set, which is small enough. 10,000 is way more than enough. We ran a model recently and published saying that 1,000 very well documented synthetic data set is good enough to represent the whole variation. The portion of people who agrees with me is getting more and more. With time, that will answer your question. At the moment, general public, no, because this is a very technical thing. You understand the distribution variation algorithms in AI, what I am using as an engineer now, is very tough. It's very new. Very few people have published work on this. So clearly, if you ask, then they say, oh yeah, there's only 2 papers in the whole world. I'm not going to buy it at this time. So again, it follows the pattern. On general side, if you look at autonomous driving, 90% are synthetic data now. People will accept it, but it will take some time. But the key factor is human in the loop. You cannot just let the AI run by itself. There need to be qualified doctors guiding the AI in the right direction.
I think that's probably one of the key learnings from the FTC HeHealth experience as one of it, but also for why you're building the GPAI.
Yep. My last 6 months is a very new startup. Because we decided HeHealth is going to continue our work, but we are not going to fight with the media, like we are not going to fight the fire with the fire. We said, and this is taught by one of my professors, Dr. Klausner, He's a very well-known professor in US on infectious diseases. He told me one day, Yudara, in 1980s when I introduced at-home HIV testing in San Francisco, people literally protest in front of my home. But I said, let it die off by itself. After 2 weeks, people go back to their work and then continue. And I continue to push my at-home HIV testing. At that time, not really at home, but there were bathhouses for MSMs. So he was very focusing on getting the people tested at those high-risk places. And now it's a standard of care. After 20 years, nobody even bother asking at-home testing is needed or not. And it's a standard of care in sexual health. And I think that helped me at that time very clearly. We lay low, we continue our HeHealth work. We published quite a lot of papers, including Nature. But again, there was no business arm of it. We were not selling anything aggressively. So Singaporeans cannot access. US, most of the part, it's not accessible, but then there are parts who can access, so and so forth. So we focus those things, get into the regulation. The core technologies we built for health, two of my Singaporean doctor friends, they felt it can be actually further built into a Singaporean primary care model. At the end of the day, infectious diseases are primary care problems. We agreed and we put some money and we run some model training. It gives good results. We showed some people, they love it. Moving forward, localization of AI to Asia Pacific is going to be a big area of growth. So then what we did is we used the government openly available, all the regulations rule, which is specifically applied to Singaporean healthcare. Technologies like agentic RAG systems, and build a model which is purely focusing on Singaporean primary care based on Singaporean data and MOH guidelines. That shows some amazing results at the beginning. And I didn't want to raise money, but few people are very insist of putting their money, and they had hospital connections. So I said, sure. And we put up a separate team, and that team is growing very well. We are officially coming out of the stealth in this year. We have cool product launch, automating through agents in almost 50 to 60% of the task in a primary care clinic, like taking the history, helping the patients gather the information, prepare the notes for the physician to review, and then follow-up care completely automated based on Singapore guidelines. So I'm very excited for it.
Could you share a story about a time you've been brave?
I think the biggest part is world's largest legal body, FTC, suing you for 50 million and jail term. I decided to represent myself without a lawyer. A lot of people felt crazy, but I believe in the truth. I thought telling the truth by myself, which is I am passionate about saving the world and giving something back. Some people say I was stupid and crazy, but I thought that's the right thing to do. If I'm passionate, I'm not afraid to tell the truth to the world, including the biggest legal body. AI was there to guide me on the legal matters. How am I supposed to answer? How am I supposed to submit the legal documents in writing? And so on and so forth. After the whole investigation, on the last day, the head of the legal who were involved in my inquiry said, "Are you sure you never go into school?" I said, "No." We were so impressed on how you submit the legal documents in writing and how fast you did it. And we were like literally turning over things usually, which they say, okay, we'll come back in 2 weeks. We were like, how about we meet up tomorrow? I get the documents and help me. One thing I did is I know AI and I believe AI can do magic in medicine and legal both. We trust that process. And then most importantly, as a Buddhist, I knew karma will always come back in right way. And I did it. It was brave by any means to me also. And now a lot of investors keep asking, do you want me to put more money? I said, this is the first time I'm saying, no, maybe not now because you're beta positive. And that gives them also confidence. And there was a very touchy moment yesterday, actually. I was in J Labs when 3 people just walked to me and said, look, and these are very well-known personalities in Singapore, one big investor and so on. He said, I don't hang out in LinkedIn much because it's all about people boasting themselves. But you were very different. You were very candid about sharing everything very openly, whether it looks good or bad, very clearly along the journey. And you are one of my favorite LinkedIn persons. I was like, wow, I didn't realize it actually literally bring a tear to my eye. I didn't realize people actually reading. And there were 3 people walked to me and one person even wants to take a picture. He said, I tell my students, this is the guy you need to follow. And I didn't realize the world is listening. That was a very humbling feeling to have.
On that note, I'd love to wrap things up. Thank you so much for sharing about your experience being a doctor who grew up in Sri Lanka and Singapore and being a pediatric emergency specialist. I think it's tremendous what you shared about the ups and downs, including the legal battles. Lastly, thanks for sharing your vision for the future for AI in healthcare across both the raw data, synthetic data, and diagnosis. All right. Thank you so much, Yudara.
Thanks, Jeremy. It's the first time I'm sharing more details about what happened on the legal side. And I'll share a very quick one. We are building a government system covering a whole population with government support, and that will be the first in the world. We are documenting a population level intervention using AI in sexual health. So we are doing it with Harvard, and I cannot tell the country at the moment, but it's a big project. So we'll be sharing more along the time. Thanks, Jeremy. Again, really appreciative. I always used to listen to Brave, and that me help understand, look, I'm not the only guy going through this. And now I'm returning the favor. And anyone who think that you are drowning in the startup world, thank you so much.
Thank you for listening to Brave. If you enjoyed this episode, please share the podcast with your friends and colleagues. We would also appreciate you leaving a rating or review. Head over to www.bravesea.com for member content, resources, and community. Stay well and stay brave.